Excellent. Well, good afternoon or good evening as it might be, and thank you to all of you who are with us on such short notice. I want to begin, first of all, just thanking Dr. Wilson and as well as Dr. Summer Merritt, as well as CEO Myers, the Health Department, City of Midland, everybody who's been a part of this process. And let me give it a little bit of a history before talking about where we are and some places we might need to visit and some actions we might need to revisit. But many weeks ago, I was, at the request of the governor, was asked to submit a plan to reopen, how we were going to reopen Midland, and that was in partnership as well with area Permian Basin cities, particularly Odessa and San Angelo and Big Spring, although everybody did not have to follow the same process. We just provided an outline, and it very much looked like what you see today, the 25% opening and the 50% and the 75%, which is pretty much where we are today. As a part of those discussions, in talking about things with Russell and with Larry, one of the things we discussed quite a bit was what were going to be some markers, what were some things we were going to be looking for that would, quite frankly and quite bluntly, cause us alarm and cause us to have to say, wait a minute, we're going to have to take a few steps back again into previous behaviors. What are some markers for the hospital? What are some markers for spikes, and so on and so forth? As you are aware, as everyone is aware, there are spikes taking place all over the country, and specifically for us, all over the state of Texas, and right here at home in the city of Midland. And so after a few conversations with the hospital, a few conversations with the health department, it's obviously become clear we're going to have to return to a discipline of some behaviors that we practiced together as a city that got us to the place where probably me more than anybody felt really, really comfortable about where we were. And then as we began to open up the economy, we realized we were still dealing with something we were going to have to arm ourselves against and prevent and be preventative as we move forward. If you're wondering at this moment, because there are so many different voices speaking into this, so many different opinions, we are not prepared to issue a mandate, or if a better word for a mandate is a law that says people are going to have to do certain things and have certain behaviors. What I'm counting on is we will behave exactly as we did as a city when this thing started in late February and early March, and we continued to beat the drum and ask everybody to do the things that were necessary. And that's why we were successful in the early days, and it's how we're going to be successful as we move forward. So a couple of things I'm going to ask all of us to do, and first of all is just to continue to be aware of your surroundings, to be aware of this call to action, and understand in the strongest terms, we are very, very serious about this. I am having to review the things I might have done and have done, and the things I'm going to do in the future. And even though we may not like the things that we are going to have to return to and become more disciplined about, it just is going to have to be the case if we are going to keep things, well, really, we can't keep things the way they are. We have to go backwards as far as cases are concerned so we can keep from shutting down this economy, both here in Midland and all over the state. We just cannot do that again. So we're going to have to get aggressive about these actions, which is the personal responsibility we're all going to have to take. Which brings me to reminding us that we're going to have to repeat the behaviors and become even more disciplined about the behaviors. We're going to have to become even more disciplined about paying attention to social distancing. And probably the one thing that most people have become quite tired of and don't want to do, but we will have to return to it, and that includes me, is the masking in public places. And I have already been on the phone with various retailers, some of those who are not going to use the words they have chosen, fight with customers to make them put masks on, but they are going to request of customers to have those masks on when they walk into restaurants, when they walk into grocery stores, when they walk into places that they can't control their surroundings. And so we're all going to have to respect one another in that regard. Again, for some, this might be going a little bit backwards. We thought we were moving forwards, but we now know we're up against this wall again. And then we will continue to monitor where we are as we continue to practice the personal hygiene. Some of you as businesses might even shut down some more. You might go back to 50% if you're able to do that. You might have your employees working from home if you're able to do that. But if we do the things the way we did them in the past, if we go ahead and do the things the hospital has been asking us to do, which is the aggressive practice of the hygiene, the aggressive personal application, myself included, of wearing a face mask in public places and when I'm around people and when we're out in public, then we'll look and see where we are day by day and week by week, and we'll see if we're making progress in combating this virus that for a while we thought we had a handle on, but we do not. So in the strongest possible terms, stopping short of some form of mandate that we would then have to enforce, which I quite frankly think would be very, very difficult for us to do, if not impossible, we can return right back to where we were as a city, doing exactly the things you did as citizens, as we asked you to do when we were combating this in March and in April and in May. We will have to return to those behaviors and see if we can get back to where we were, if not better, so we don't have to take more drastic actions in the next few weeks and indeed the next few months. With that, it's really quite simple what we're going to have to do. It's not any more complicated than that. And so I will turn it over to the hospital, and then when all of us are done speaking, obviously I'll be ready to take any questions.
Thank you, Mr. Mayor, and I sincerely appreciate your leadership on this question. I think you're right on with regard to what you're recommending to the community, and it's consistent with what we said in our press conference this morning. This is a personal responsibility question. There's not really any question about what it is that we're called upon to do. We just have to step up and do it. One of the things that in my own mind, this is an easy way to think about it. I have a mask on anytime I'm within 6 feet of another person aside from my wife. And I think that's the way that we all should look at this. You don't have to have a mask on every moment of every day, but if you're in public, if you're among other people, especially if you're going to be there for a while, you should have a mask on. It's tough to do that if you're having a meal. We recognize that. But that's about the only time that it makes any sense not to be masked. And so please do listen to the mayor's words, listen to what we're saying. Let's do this and quell the spread of this virus. It has certainly exploded on us here recently. And it's mostly happening because we are more social. We're more likely to be among other people. We're traveling more. We're gathering as families more. We have to be that much more diligent in taking care of those hygiene and social distancing needs as we reopen our lives and gather more often than we have been. Some news from the hospital side that is our response, and the thing, and as the mayor said, we're essentially backpedaling to where we were when we were beginning to get this under control. So visitation will be very limited. It's not zero. We have patient populations who can have a visitor, those who cannot speak for themselves, those with dementia, children, et cetera. If you have to have a guardian or someone with a power of attorney to speak for you, then that person may come into the hospital. Our outpatients, by and large, will not be allowed to have a support person with them in the hospital. Children, laboring patients can have a support person plus a doula, so they can have a second person if that's their choice. And patients who are actively dying, who are at the end of life and need family to come and support them. That's it. And we're going to make very few exceptions to that. The idea is not to make people miserable, but rather to minimize the contact and the potential for exposure, recognizing that we have so much more disease in the community. So that's happening here. Our surgeons have met today to talk about whether we remove the openness we've experienced with regard to elective procedures, and we're not ready to back up on that just yet. The hospital's census has grown a good bit. We were at 20 this morning. We were down to 18 just now, but we know we have a patient or two in the ER, so we're going to still be right around 20. If we get a few patients higher than that, we're going to have to seriously think about curtailing inpatient surgery. But we're not really at that point yet. We're very close. We're going to be watching it every day, engaging our surgeons. And if we see a little bit more census growth, we'll have to dial back the surgery cases that are going to result in an inpatient stay. Outpatient cases are not in any danger of being suspended at this point, even though I think we all know the governor has shut down elective procedures in 4 hard-hit counties around the state. That remains a possibility for us if our numbers don't slow down, but we're not at that point just yet. So that's the main things that have happened here. One more item that's not quite finished. We are actively working to put another drive-through testing location in place. We have a little bit more logistical items to work through. We're having some challenges because there is so much testing going on. The send-out labs are beginning to push back, that they're overwhelmed with volume. We have some ideas about where testing might go, but as soon as we can work out those details, we'll be announcing a second drive-through testing site, expanded capability. We're aiming to put that on the south or east side of the community, so it's more accessible to our population in that part of the community, which tends to be much more underserved. But don't have details of that yet. We'll have a conference call or a Facebook Live on Monday morning at 10. And I hope that by that time I can give you more details about how we're going to handle expansion of testing. Dr. Wilson would like to make a couple of remarks, and then we'll be prepared to open it up for questions.
Thank you, Russell. And I want to thank the mayor personally for listening and recognizing the importance of the behavioral change that's going to influence this progression of disease that we've been seeing. I've had several conversations with physicians and others around the community, and I think everybody has seen what we've been experiencing here since Memorial Day, opening things up. People, I think, took that to mean not just getting back to activity, the economy, businesses, but also to behave like things were back to normal. And unfortunately, they're not. Unfortunately, we haven't seen the COVID-19 virus, the coronavirus, respond to the weather, the dry weather, as we would have hoped it would have. And while we've watched this acceleration, we went from, as Russell mentioned this morning, 3 patients in the hospital a little over a week ago to 21 patients earlier today, now down to 18 with a couple of discharges. We're doing better with the treatments, and patients are getting in and out of the hospital by and large. We've been keeping the infection largely in younger-ish people. So the older population, the Midland Medical Lodge populations have been protected, and I appreciate everybody being careful about that. But as we spread it among ourselves, regardless of your age, there's going to be 10 or more % of the population that ends up hospitalized with oxygen requirements, with influences on their GI tract and their ability to process foods and to feel weak, and et cetera. And that population, as we get more and more sick, this trajectory has been astounding. Last week, we were averaging a little under 20 patients a day that were testing positive. This week, we've been hitting the 40s. In the next couple of weeks, it's going to continue to accelerate. Today's behavior casts the die for 2 weeks to 3 weeks into our future. So everything that you do, if we get perfect in our behavior starting tomorrow, the acceleration is going to continue for the next 2 to 3 weeks. Then we'll begin to see a nadir or leveling off and begin to see a decrease. But we are not going to see that now, and the acceleration is going to continue for the next 2 to 3 weeks without question. So our hospital now, with the census in the 20s, next week we could easily be in the 40s. The week after that in the 50s or 60s with just COVID patients. And if we're in that kind of a position, it's going to be very difficult to manage that, let alone take care of all the conventional things that are going on. So as Russell mentioned, the concern for being able to keep going with normal operating room procedures is in question. So I really appreciate the statements by the mayor, the city standing behind that. I really ask everybody to take that consideration very, very seriously, how important it is that we socially distance and we wear a face covering. You've heard me say this repeatedly, but that really decreases the expansion of the virus into the air around you. And no matter what anybody thinks, you can't tell who's infected. And no matter how familiar you are with somebody, if they've been exposed while they're still not having symptoms, they could be shedding virus. We've got to get our handle on this. We've got to get this shut down, or things are going to get very, very much more difficult for all of us. So please, I appreciate everybody listening. One other thing I'd like to make a point about is testing. Russell has mentioned it's a complicated issue, but we have a lot of problems getting the test results back as well as we'd like to, and having the resources to do as much testing. We'd like to reserve the test for those people that need it. Because you've been exposed doesn't mean you need a test. Please, if you've been exposed to somebody that's got the infection, do the right thing. Wear a face covering, stay away from other individuals, self-quarantine for the 2 weeks. As long as you remain asymptomatic, that's all that you require. If you develop symptoms, get tested. If you're an essential worker, continue to work, but wear a face covering, be cautious. But we have to be thoughtful about what we're doing, how we're doing it, identifying the sick, and contact tracing. So with that, thank you very much.
Thank you, Dr. Wilson. All right, Mayor Payton, the first question is for you from Scott Pickey. He says, returning to how we were acting a few weeks ago means shutting down bars and gyms, a percentage limit on other public places. Is that your plan? Ector County Health Department says many young people are getting sick at bars.
Scott, thanks for your question. We do not at this point have an intention, although you are correct, if we went all the way back to where we were at 50% and then 25%. At this point, we don't have any plans to ask businesses to shut down and to go backwards from the 75%, but that doesn't mean that these retailers, that these gyms, that these bars are off the hook. In fact, they need to step up their game. If I was going to be quite blunt about it, which I will be, that's probably where a lot of our spiking has taken place, is just in people recreating and being out to eat, and sometimes the precautions not being taken at places to eat and places we recreate. So I think it's very clear from this message from the three of us that we're going to have to really, really get serious about this. Or Scott, the other part of the answer to your question is, then we will have to go backwards. And the last thing any of us want to do is begin to shut down businesses again that were so hard hit in March, April, and May. So I hope that answers your question, Scott.
The next question for you, Mayor Payton, is from Danny. He asks, would the city of Midland consider using electronic billboards reminding people in town or coming into the city of social distancing and wearing masks?
Well, it's certainly a great idea. I think we can consider that. I think some members from the city staff are on this call, and we can look into what's available and begin to do that. And as well as we'll be promoting on social media. And we have also even been producing commercials and public service announcements that we'll be releasing as a city as well. So any means we have possible to get this message out and to keep this message out, we'll be doing that.
And the next one is, do you expect the city council will be wearing masks during meetings or going back to virtual meetings?
I would imagine we'll go back to more of a virtual meeting format at this point and until further notice. And we'll be talking about it as a council as well. But at this particular point, it probably will just be best for us to go to our virtual format that we had before.
Okay, and the next question is for Russell. This is from Stuart. He asks, did the county's chat system provide you any information that this spike was going to take place?
Dr. Wilson knows more about that than I do, so I'll ask him to answer the question.
Thank you, Russell. I reached out to the judge about the chat, and he got me in contact with the administrator of it. And interestingly, they saw in their statistics on the week following Memorial Day an uptick in symptomatic answer yes on the chat that preceded our recognition by higher testing positives as well as hospitalizations by probably 2 weeks. So it did have a demonstrable recognition of sicker people earlier. So
the next question is for you, Dr. Wilson. Stuart also asks, if these numbers don't drop by cold and flu season, what would that look like?
It'll look confusing in the context that anybody showing up with respiratory tract symptoms and a fever could have any of the above. So fortunately, many of the testing platforms that we are looking at have cartridges that will test for influenza as well as the COVID-19 in the future and even strep. So there's platforms that will give us the answer to any of those with one test. But it's again getting the tests and having the COVID added to it, which is hopefully by this fall we'll be in a position we'll be able to do that. But remember too, with influenza, there's patients that end up in the hospital. With RSV, there's patients that end up in the hospital. With COVID-19, there's more patients that end up in the hospital. So it's setting up to be a stormy fall.
Thank you. Mayor Payton, this next one comes from Scott again. He asks, is there any teeth in what you want to do?
Thanks again, Scott. There are no real legal teeth to this. What we're counting on is the teeth of the influence of our community that acted the way they should have acted, and we had to act in March, April, and May. When people, as I said many, many months ago, I said when the city of Midland, when the people of Midland, oftentimes we are slow to believe that something is necessary for us to do, but when we find out it's necessary for us to do, people go about doing it. I have no reason to believe that people, knowing what the expectations are, knowing the seriousness of the issue by us gathering here today, will not take this seriously, and they'll put the teeth in it by their behavior, and they'll put the teeth in it when it comes to retailers and establishments of business who don't take care of patrons and don't take care of this issue. They won't bring their business to those places. So I'm hoping that will be all the teeth we'll need to move us forward.
And for the people that are watching on Facebook, we had a little technical difficulties with our live stream. Can you just kind of summarize what your first message was?
Which person, me?
Yes.
Okay. Well, the summary of the message was we have, to begin at the very, really what is an important part was working with the hospital with Dr. Wilson and Mr. Myers and myself many, many weeks ago when we were putting a plan in front of the governor. We had some markers in place. I remember us specifically talking about this question of what numbers in the hospital and in the community would concern us. And sure enough, even though we were hoping that wouldn't happen, we are at that place, which is then requiring us to get in front of all of you and talk about the seriousness of this issue, of the renewal of our behaviors, to use a word that Mr. Myers used, sort of backpedaling back into the behaviors of the social distancing, and also being very, very disciplined about our mask wearing in public and in our stores and all places. Even though I'm chief among them, do not like wearing a mask and cannot wait for the day to not do those things. The day's back where we're going to have to re-enter that world, and I'm going to have to re-enter that world, and we're asking this community to re-enter that world of discipline until we can get to a more positive side of this.
Okay, thank you. And then the next question is for you as well. They ask, so why are we having city-sponsored events like movie nights in the park with the numbers that are happening?
Well, again, there's nothing that says we can't have events. It's how the events are had. As long as there is social distancing, as long as people are doing the things that are necessary with the wearing of the masks. The message here is not stop doing everything that you're doing. We're not going to close down the economy. We're not closing down activity, but there are things we have to do in those activities. Now, the day may come in a few weeks, as Dr. Wilson told us, the next 2 or 3 weeks are critical. So in those things that you're doing, whether it's going out to eat or whether it's a movie in a park outdoors, which is probably the best place you can be, outdoors, social distance, and with your mask on, if we're still not able to get ahead of these things, then we're going to have to continue to backpedal until we do. But at this time, I believe thoroughly if we do the things that are being asked of us, if we're doing the outdoor things correctly, then we'll be able to combat this virus and we'll be able to win on the other side of this.
The next question is for you. It comes from Mitch. He asks, Mayor Payton, for months the city and MMH have been asking Midlanders to wear masks and social distance. Case numbers continue to grow, and from my observation, a lot of people aren't wearing masks. When is just asking people to wear masks not enough, and when is the right time for the city to step in and mandate businesses require customers to wear masks?
Well, the right time to make that request to people is right now. Whether we need to do that in a more serious manner, in a legal manner where there might be penalties, we'll see if that time comes. But I've already seen all the same things that Mitch has seen, and this is why we're doing what we're doing now. The right time is now to ask the people to do the right thing.
Okay, the next question is for Dr. Wilson. Dr. Wilson, they ask, once being positive, can you be tested negative at a later time? How long do you quarantine after not having symptoms?
Okay, so this is, I think, back to the question around what is recovered, I believe is sort of the focus of this question. So there's 2 ways of being recovered. One is by time from symptoms and recovery from symptoms, and one is by testing. So if a person becomes ill with the infection and tests positive, or even if not, if you have an illness and you have a fever and respiratory tract symptoms or what have you, you recover. You no longer have fever. You're not requiring Tylenol or aspirin to treat your fever, and you go for 3 days without having fever and the other symptoms are all resolving. At that time, you are considered recovered from the standpoint of symptom resolution. Whether or not you may still have a positive test with an RNA test isn't clear. You may test positive, but it's unlikely that the RNA that's being picked up is in a viral particle that can be transmitted to another individual. So this is the CDC and the state directive about how you can be recovered by symptom resolution. The other mechanism is if you test positive with COVID and you go through your illness and you test a second time and now you test negative, that is considered recovered as well. So either of those two mechanisms, by either symptom resolution or testing positive and then testing negative, are both considered recovered from the infection.
Thank you. All right, media, do you have any other questions? Remember, if you don't want to type it all out, you can use the raise your hand feature as well. Russell, Mayor Payton, anything else that you'd like to add before we close out?
No, the last thing I would just want to repeat is thankful again to Mr. Myers and Larry and others who have continued to keep us aware of what's going on. And really, there's no stronger way for us to say that we're at a juncture now where we're going to have to get as serious as we got in March. And hopefully we'll have a better July and a better August.
Hospital folks will speak to you again Monday morning at 10. So thank you all for joining us.